There we go. We got to start that way now. Otherwise, someone gets mad at me. No, here we are. We're live in Denver. Rev Cycle Unscripted. My good friend,
Philip Boyce.
He's like, Philip Boyce. How many times have you been on the podcast?
This is number 2.
Is it only 2?
Yeah.
Was it live last year?
Vegas. Yep. Yeah.
We've never had you on otherwise?
No.
Wow.
But I think I am one of your good friends.
That's 100% true.
Okay.
Yes. We're not using that. I'm not using that anymore. But of course you are. We've known each other since 2018. Does that sound right?
Yeah.
You took the role. You were new in the VP.
Yeah, that's right. I took the role in 17
role, yeah.
and I got invited, I think, in 2018, that summer, I think it was Phoenix and then Denver.
Yeah.
And I met a lot of great people and just tried to get all in, learn what I could.
Then the COVID hit.
Right.
I went to crap. That's another story.
Yeah. So how have your podcast been here so far?
It's been good. Yeah, it's been good. It's been, we're back to back today. So it's like a little bit like, okay, go to the next one.
Yeah.
But we've been doing 30 minutes or so. So it's not like it's too long.
Yeah, that's good.
No, it's really good. So what are you working on these days? What's keeping you up at night?
Wow. What are we working on? So we'll be on 3 years on Epic, end of July. So almost 3 years.
3 years already?
Yeah. So when I, started, we weren't on Epic. Everybody was on Epic. We weren't on Epic. And, and then we spent a year and a half getting ready for it. And it was about a year and a half of getting settled in and our hair no longer on fire. And so probably last October was when I finally since 2017, said, okay, I can take a deep breath and we're okay. We're doing fine. I first started, it took a couple years to really get my arms around Rev Cycle because I'd done managed care for 18 years. And then the CFO said, would you take the revenue cycle also? And so 2 years to get my arm around it. And then COVID hit. So now, we're taking everybody remote and getting through COVID and shutting down elective services and bringing back elective services. And just about time we get through COVID, they decide they're going to go to Epic.
Right.
So then we spent a year and a half preparing for Epic, then a year and a half getting stable on Epic. And really it was until last October, 24. It's like, okay, I think we made it. Like we survived.
Right.
I kept my job and health system didn't go under and we didn't get in the newspapers. So
it is like you do kind of like, there is this like, I don't know what the inflection point is, but it's like, oh yeah, I feel like
we're going to be okay.
We're going to be all right. We got used to things
We made it, but I have great leaders. I have just some fantastic leaders I have a lot of outstanding leaders in the revenue cycle that are doing a great job. And I would say the biggest thing I've learned is 2 things. Collaboration. Like the revenue cycle is such a team sport that front, middle, back, the support areas, rev integrity, like everybody has to collaborate together to close gaps, to fix things, improve things. It's not just the front end doing the front end stuff and the back end doing the back end stuff and the middle doing the middle stuff. Like it really takes the collaboration of all the leadership, whether it's denials, whether it's improving workflows, closing gaps. So collaboration in leadership, engagement, collaboration are really the keys. If you have the right leaders, like they can figure stuff out and get it resolved. So the other thing that's been interesting to me is now on Epic and pretty settled in and so forth, the clinical areas where they're not following workflows or they're doing things that aren't compliant, that either cause a denial or lack of payment or some problem. And then like the revenue cycle, having to work with the clinical areas to show that, like, when you do it this way, here's what happens. And the clinical people are just taking care of the patient, the clinic, they're not really thinking of a workflow process necessarily, or compliance. They don't understand maybe the compliance part of it. So working with clinical, educating them, closing gaps, that's been interesting. But the thing I'm really proud of, because it was the only thing I really knew, was when I got the revenue cycle, I wanted to integrate managed care with revenue cycle, because I'd been managed care for 18 years.
That was your world.
The revenue cycle people didn't really let us in very much, and kind of didn't really want us a part of that. They would come to us and say, can you get the payer to do this? Can you get the payer to do that? But other than that, we didn't really collaborate. So it's taken 7 years to really integrate, longer than I thought it would take, to really integrate managed care and rev cycle. Rev cycle are operational leaders. They're operations. Managed care, it's like Mars and Venus. Managed care is, you're dealing with payers, you're dealing with, external. Managed care people don't really understand revenue cycle. Revenue cycle people don't understand managed care. So the learning experience of our managed care people to really learn rev cycle and vice versa has taken a number of years to really, integrate it. But what we do is our managed care contractors, those that are negotiating contracts with the payers, that have that payer relationship, they lead our revenue cycle JOCs. So they have to know all the revenue cycle pain points and issues that rev cycle's having with the payer,
right?
Because they're leading the meeting. Now, when they're contracting with those payers and when they're interfacing with those payers, they know all the revenue cycle pain points inside and out because they lead the meeting. So our team, managed care and rev cycle, are really now one team, just collaborating, working closely together. And to see what they accomplish has really been rewarding. But it's not been easy, and it's been much harder than I ever thought it would be, because I thought, managed care, like, yeah, and then I'm breast, yeah. But no, it's kind of a Mars and Venus thing.
So did you, when you say you're integrated more, I get that they're leading the JLC, but how do they
So we have
how do they integrate on a daily? That's well, actually they're talking to each other because
so they're meeting. So we have JOCs with a lot of payers.
Sure. Yeah,
and they're meeting the managed care contractors who are leading those JOCs are meeting with rev cycle leaders and rev cycle people on the issues, understanding the issues. So they're talking about the issues of each payer and preparing for that meeting. So that puts them in, kind of conversation.
Yeah, right.
But then we have a payers. We rename managed care payer strategy. So we have a payer strategy rev cycle ops meeting every week where they're addressing issues, things that come up. They're working through things. So basically gaps that we have with payers. Payers are causing things. Maybe their system's wrong. Maybe our system's wrong. Maybe whatever the issues are, like they're meeting and they have, and all of our revenue cycle leaders, whenever there's an issue, we have a whole smart sheet process. So they're sending the issues to smart sheet. They're explaining it and all that kind of stuff. The payer strategy folks are managing that smart sheet. So they're just working issues on every week.
No, that's interesting. Yeah, it's so funny you talk about kind of 7 years of integration.
Yeah.
But it's true. It's it's not easy when it's
takes time. Yeah.
I got my thing and I'm doing my thing. And
well, and I mean, I kind of understand it. I was in managed care, and so I didn't really understand rev cycle. I didn't appreciate it. I didn't really know it. I mean, I knew you had to register somebody correctly.
I know, I understand.
But to really understand the issues,
no, it's a unique.
Yeah, there's a lot to it. So it's been a journey, but now I'm just really proud of the payer strategy and rev cycle leaders, how they just work together. They see themselves as on the same team. They just feel like they're all part of the same group, which is great.
So I got a question for you.
Okay.
I was curious. If you could kind of like, because you've had a lot of experience kind of doing different things within the health system, right? So you had rev cycle's not your only bag. That's a new thing for you.
Managed care was the other thing.
Yeah. So managed care and rev cycle. But if you could go back to like your younger Phil, young Phil getting into the work world, like, I don't know, what would you tell that person?
Wow.
Because I don't know, I'm curious to know because part of me is like, I'm always curious to know, like, what's the day-to-day look like for somebody,
Yeah.
But also, like, you could talk to that younger self and be like, this is actually what it's going to look like, or, hey, maybe don't do this. I don't know.
That's a good question. Wow. I would probably say find a mentor, like seek out mentors and find mentors that are willing to work with you. I didn't really do that. I don't think I really had many mentors. So you kind of learning by trial and error. And, had I had maybe mentor kind of in more official, like, yes, we'll do a mentorship thing for a year kind of thing with the COO, or with the CEO or with somebody in the C-suite.
I think we think it's like, it's a good point. It's a really good point because I feel like, at least back in the day, I would think, well, my boss is going to be that person, but that's a luck of the draw.
Yeah, right. And
like,
it's not necessarily.
You could get super lucky and find someone who really actually like, this is how I want. I'm guiding you. I'm helping you. But it's also a different relationship too, because they actually have to hold you accountable.
Right. They're doing your evaluation. They're, and the boss may not want to really be a mentor, So then what do you do?
We've all had those.
So I probably would have encouraged me to look for a mentor has at a higher level, has accomplished, really something that had that wall of separation, that it wasn't your boss, and, kind of set something up formally. I didn't have a mentor relationship. And so I think I could have really benefited from that.
I work with my graduate school, like I was health administration at VCU, and so the last like 3 years I've been really more involved in and so they'll do mock interviews for residency. So you have to do your residency following graduate before they can graduate.
Right.
You do 2 years of school and it's a great program because it's like you gotta get some experience but it's like kind of guided experience.
Yeah.
Right? Well, they are all nervous, so they're doing these like mock interviews and they get to me and I'm, as you can imagine, I'm not your typical graduate.
Right.
And so I'm always like, hey, like, you get enough of these. Like, what questions do you have for me? And without fail, they're getting some advice that I'm always like, other people are telling them, or the teacher, the professors are telling them. And they're all nervous about where their residency is and like how, exclusive is it or how premier of an institution. Or it's like, well, I want to specialize in this. I'm like, do you? So I'm always a little bit like, really?
You're 22 years old.
Yeah, you really know that? Do you? And some people have like a family or story that's like, gets them. And okay, that makes sense.
Yeah.
But my advice is always like, I'm curious to know your reaction to this. My advice is always, well, I would 100% all day pick a preceptor because their preceptor is really the one that they're not working with every day, but they're the one that mentoring them.
Yeah,
right.
Right.
I said I would find the right fit on a preceptor every day to a small community hospital versus like a big academic that everybody knows.
Right.
All day I would choose the other one if it's a preceptor that's going to invest in me and someone that I connect with that's actually going to be like a mentor.
Yeah.
Versus someone because I'm just picking this larger position.
Right. That may not really care that much.
May not really care. And then every time, almost without fail, this is surprising. I was surprised. They're like, man, I haven't heard anyone say it to me.
Wow.
And I was like, okay. But like, that's what I would do. Like, I would be choosing that all day because I got fortunate. I just got fortunate. I got this guy, Tim Stack. You might never heard of, but he was CEO a long time at Piedmont. He died a few years ago. He was just incredible. Just this incredible guy. Great mentor, great, like someone who just like
did so much for you.
Helped
as
me
a
kind of
person.
like, and then he connected me with another person, this guy, Pat, who's also amazing and just, and at times gave me tough love and stuff I needed to hear.
Yeah. Super valuable for a young person. Yeah.
I mean, I just came out of graduate school and, not that I felt like I knew everything, but I felt like, oh, I'm ready to go,
Yeah. Here I am.
Give me the job. Give me the job. I want to do it. It's like, I'll do it. I'll do whatever. My graduate school, so I went back and they asked me to speak on RevCycle,
Interesting.
last year. So I did 2 hours on RevCycle, which they were blown away. None of them knew any of this stuff. It's crazy. But at the end, I'm just taking questions from them. And then someone asked me like, do you regret anything? Kind of like as you went out, because I have a very different path, obviously. I'm not your typical health administrator. And you know what I said? I said, I wish I wasn't such an asshole. and I wasn't like I was mean to people. I just said, I think I thought I really knew. And I was like, that I was smarter than people, that I knew better. And the reality was, like, I didn't know any of that stuff. Like, I should have just kept my head down and did my stuff. And I did that to a degree, but I was like, that's what I wish I would have been better at.
Yeah. No, I mean, when you asked me that question, like, I don't know if anybody would have told me anything back then that I would have even listened to, because you kind of just think, you know what you're doing, and I got this, even though I didn't, but yeah.
But I think it's like I got told the guy, Pat, he really put me like, he would at times be like, almost like this, like, okay, that's a way you could go about it. But let's think about these other ways, I was like, okay, yeah, I hear what you're saying, but I actually called him probably right after I did that thing with my graduate school. But I hadn't talked to him in a long time. And I was like, I just want to say I'm sorry.
You were so right.
And he was so good. He's like, sorry for what? No, he's like, that's okay. It's like, but that's why that I was in the role I was in. It was my role to guide, to push back, to challenge. You're in that role now.
So did you go into RevCycle out of graduate school?
No, I went right into health administration, like
hospital administration?
Yeah.
I didn't know that about you.
Oh yeah. Oh yeah. People are like, what? I was like, yeah, no, I know, it's crazy. No, I worked for a hospital.
Where at?
Kalamazoo, Michigan.
Oh, you went to Michigan. Okay. What role did you, you did an intern, like your third year.
Yeah, right? It was my resident.
Yeah, and then after that, it turned into.
Thank God they gave me a job, because I actually had no idea what I was going to do.
Right.
And I told this to the graduate students now. I'm like, guys, VCU and all these graduate schools are awesome at getting you ready and getting you to residency. I said, but afterwards,
right, doesn't guarantee you have a job.
They're not thinking about that. All they're thinking about is like, you got to get a residency, right? And I was like, I didn't even know what to do.
So what was your first job after your residency?
Well, luckily this guy Pat, he's like, how about you just be like internal consultant, and we'll just kind of continue to do projects for a while. So I did that for like a year and a half, worked for him. But then a job opened up in surgery called business manager of surgical services.
Like the surgical suite, like managing the scheduling of surgical scheduling and all that?
Yeah, so I got, so I took it, and Pat was like, I think it's time to get in ops, and I was like, yeah, I'm probably ready. No, it was the worst thing and the best thing for me, because it was terrible at times. But it was also the best thing for me to like realize, like, I'm never going to do this long term. But I learned what it was like to work with surgeons, and I I had central sterilization, so reprocessing, which is crazy. If I think about it back today, that Anne, who had been there 50 years as the director, was reporting to me, which is insane. She was great. This sweet woman. And I had the schedulers, and I had supply chain.
Wow.
And supplies was the most interesting.
Yeah.
I mean, just by far, like, just really incredible.
People
and all the data analytics.
Yeah.
There's a lot of analytics. I was running reports. I was
you had reps coming into the OR with their stuff, and
and I learned all about I learned that world, which was like, now all of a sudden they wanted to be with me.
Yeah.
So they're like, come to golf. I'm like, golf? I'm like, this is awesome. And then I realized, like, well, actually, these aren't my friends per se.
You're making them a lot of money.
Holy cats. But it was, it was one of those things where you like.
So then what? What happened after that year and a half or that job?
I want to say I did 3 years in the OR.
Wow.
And it's funny you ask. There's a director of the OR was there 30 years. Mary Jane Privé, who I love to this day. She's amazing. And she taught me so much, right? Yeah. She's so just this great human. And then she retires. And at the time, and I don't know if it's still true today, but at the time, like director or VP of surgery was actually like the hardest role to fill. Yeah. It's just like nobody wants. Right. It's like a terrible. It's a tough job because you're working with surgeons and everybody. Yeah. And we had 4 unions in the OR.
Yeah, that would be.
And I'm learning from all these managers.
And then you got the administrators,
and they're great. Like it's just this wild place, right? Like every day they're getting
you got patients coming in.
So Mary Jane retires, we can't find someone to fill the role. And none of the managers want it, right? Directors, managers, nobody wants it. And I don't blame them. And we hired this consultant. And she's like, there's one of these intern people. I've actually never seen her again. And she just comes in and she really taught me so much. Like just how to be a consultant, but also how to like cut through the noise and be like, no, we're going to get these things done. People hated her in the beginning. Hated her. But at the end, and I left, I ended up going to a creative, like kind of before the time she was done. She was there like 2 years.
Wow.
But I spent a year with her. And I remember, I'll never forget this one interaction. This is just to give you an example. We're in her office and I'm going through reports. And the phone rings, and in her office, phone's ringing. And I go, do you want to answer that? And she goes, no, it's not for me. They're not calling to talk to me. And I was like, what is happening right now? It was amazing. It was amazing. But she's the first person to tell me to probably be real. Give me real feedback. And she said to me in one meeting, you're the best analytic mind I've been around.
Wow.
But you're not a good manager of people. I was so offended. I was so offended. And I was like, really?
The hard truth.
And to this day, I would say like, she was 100% right. Like, I'm a good leader as in like visionary.
Yeah. But in terms of managing,
the day-to-day of managing, especially I like all these hourly people, right?
4 unions.
I just wasn't good at it, and I didn't love it. Like I love the people aspect.
You know what's interesting?
Of like developing people, but not like the firing and
Are you looking for a judgment-free revenue cycle space? Do you want to expand your revenue management skills and learn insider strategies? Check out RevCycle 101. Unlock the foundations of healthcare finance with RevCycle 101, a comprehensive course designed to give anyone, from a recent graduate taking their first professional steps to a seasoned sales leader refining their expertise, the clarity and confidence to excel in revenue cycle management. Through easy-to-understand terminology, practical tools, and proven methods, this course demystifies the complexities of the revenue cycle. It equips you with the skills to drive results, optimize operational efficiency, and significantly advance your career in the shifting realities of today's healthcare industry. Click the link in the description for more information. Now back to the show.
So one thing that bothers me about our health system, and I think it's true probably at most health systems, is you have, I call them super workers. You have these analytical minds, these really good workers, and you don't want to lose them. They're doing a great job. So the only way to pay them more, once they get to the top of the salary scale or whatever, and you get their job reevaluated, but you hit a wall, right? So you want to pay them more. And they're super workers. So you put them in a management role, and they're not good managers, but you didn't want to lose them. And the only way you could pay them more is now you make them a manager, and now you make them a director, right?
Yeah.
There's not a way to pay the super worker more to keep them as a super worker. So what happens is the super worker now as a manager has this team, sits in their office. The team's dysfunctional because they're not a good manager.
Right.
They love being a super worker, so they do a lot of the work of the department. The people in the department is like, well, okay, if that person's going to do the work, it's a mess, right? You don't have a way to pay a super worker more. And then the people that aren't super workers, they're not superstars in the department, but they have the gift of management. And
but we rarely give those people the job.
Rarely give them the job because they're not the super worker. But if you get to know those people, you're like, okay, this person is a leader and could do well.
Yeah.
But because they're not the super worker, you don't identify them. So that's something I think in healthcare.
No, it's 100% true. The other thing that happened to me, which I think is it seems like it should not happen this way. I went and got a graduate school degree. I come in immediately as like a manager.
Yeah, right. And you've never managed people before.
I didn't. There's no, right. So it's like I skipped all these steps because I just happened to be fortunate enough to go to grad school,
to be able to go to grad school,
or to be able to afford it, or whatever it is. Right. Like I was able to kind of just come in about this level, all these levels,
right? And
then you're kind of expected to be like, well, you're a leader. You went to graduate school.
Yeah.
I was like, shit, I don't know what I'm doing. Sure, I know what I'm doing at all.
And I picture like a software development company, so Silicon Valley or whatever. If you've got a super programmer who is just killing it in programming games or whatever you're software developing, if you've got a super programmer, I bet those companies can pay that programmer whatever they want to pay to keep that programmer programming. They don't have to make that programmer a manager to pay them more.
That's right.
And it seems like in healthcare, we need that same kind of flexibility.
It's too structured. It's like, this is the way it is. I'm not going to pay an RN just because they're amazing, this and another. Like, I don't know, maybe we should.
Yeah, to keep them.
Because those people are worth their weight in gold.
Right.
No, it's kind of a messed up system. I think my issue is and my team would say the same thing. In my role I'm in now, I'm a CEO. It actually fits because I'm a visionary. I can lead. I have a CEO, Helen, you know her.
Yeah.
She gets stuff done.
Yeah.
And and I don't. But my thing is that I was always assuming that people were doing the work. I was like, I give a lot of freedom because I was like, well, I mean, I'm doing what I need to do. You should be doing what you need to do. And that was always my downfall. It's like, you can't assume. I had this one quick story of one of the first firings I ever had to do.
Gosh.
Right? I had a surgery scheduler. And I always had 3 surgery schedulers that always have been the same. All the doctors knew them, and our office was right off the corridor where the waiting room was, the surgery scheduler office. So the doctors literally just go down there and be talk to so and so, and
we need to get this patient.
Yeah, can you move this person's blocks? So the big thing was blocks, back in the day. I'm sure that's still an issue. Well, this one surgery scheduler there's always this rotating position. So I hired this new person, right? And someone's one of my people who's been there a long time. She's like, I mean, she's nice, but I mean, she's not taking a lot of calls. And and I was like, what? So I'm like, what are you talking about? She's like, I'm thinking she's on the phone a lot, but not taking calls, right? And I was like, back in the day, if you remember, you'll remember this, there was a thing called long distance. And it costs, right?
You had to pay for long distance calls.
for long distance calls. Well, so we had a phone system, so I was able to pull the logs. So
Yeah.
I told Mary Jane, I think there's an issue. Like, what should I
Yeah.
do? She's like, pull the logs. Let's just see what's going on. I swear to God, this is a true story. I pulled a month's worth of data, month's worth of logs, calls. She had so many outbound phone calls, and they would last like 50, 40 minutes, an hour and 20. This is no joke. And at the end of the printout, like the report out, I'm just remember going through these pages, and Mary Jane's like, oh my God. At the end of the report out, it was like $2,350 worth of like long distance phone calls.
What a great job for her.
Oh my God, I feel like an idiot that I even kept it on that long, right? I'm like, I'm a moron. I really should probably be tracking some of these things. So I remember Mary Jane's like, okay, we're going to bring her into the office. I'm going to see her, never do these conversations alone, right?
Right.
I had my HR person, Sherry, she's like on it, so it's like, okay, well, so we bring her in and I said, well, do you know what's going on? It looks like, I think you're doing a fair amount of like calls out, and we don't really do that, like unless it's like emergency. She's like, no, I'm not doing that. I'm taking calls. And I said, that's interesting because I have this 20-page report that would say something different. And she just goes, and I go, yeah, we're going to have to let you go. She's like, yeah, sounds right.
Busted.
I was like, that was the only one. I was nervous going in, but I go, I felt great because she deserved every bit of that.
I just learned recently about mouse movers. Have you heard about mouse movers?
Yes, mouse jiggler.
Mouse jigglers.
We learned that at Forum.
Was that where we were?
Yes, that's where we learned.
Okay, but there's
like
maybe
software.
This is the new thing. There's mouse jiggler detection.
Yes, detection software
that can detect the mouse jigglers.
Yes, it's ridiculous. The whole thing is crazy. It's like
that's like just taking the phone thing to the next level of like looking like you're working because you're.
I mean, I'm on the phone working. I'm talking. Like, you're not taking any calls. You're not doing actual work. Yeah. So, anyways, yes, I learned quickly it was probably not my bag, or at least that level. I think the higher level where it's like professional level people who are.
And you have your people, and then
that was better. Yeah, that was better, but not as good as today. Today's.
So when you went to Accretive, did you go as a manager or director?
Yeah.
Okay.
Yeah, something like that. Yeah.
All right.
Manager, and then, I was doing my thing. But it was still hard at times. I mean, I just never was an operations person. Like, I was on the Axis for a while, and I remember just saying,
I hate this.
24/7. I was like, this is terrible.
This is hard.
I don't need someone texting me about, like, we don't have coverage in the ear. Like, I don't.
On Saturday night. So
yes.
How long were you at Accretive?
5.5 years.
Okay. So I've taken this podcast over. I'm interviewing you.
What's happening right now? You're interviewing me.
There's a lot of people that don't really know your story, Ben. So I'm just trying to help get your story.
I can tell it too much.
So Accretive, you're like, okay, I'm really not operations. Like that's not. I don't love operations.
And then my initial first role, like probably for the first year, was in like access operation.
Yeah, that's hard work.
And it reminded me like almost too much of surgery. And so, but I was able to get out of that, and I got into PFS.
Yeah, on the back end.
Yeah, and that was better.
More analytical.
But then it was hard. Like they put me in a role that was probably just too much for me.
What was the role?
I was over all like this huge CBO, and it had 17 hospitals. And we were merging in hospitals. We had an India operation we were starting. It was hard.
Yeah,
it was hard.
Yeah, and a lot of administrative detail. I'm not.
Well,
that's not my thing either.
You know what the hardest part was? It wasn't just administrative detail. It was you have at least 8 CFOs of health systems that don't really want you to have their stuff.
Right.
They didn't want this, and now they want answers.
Yeah.
And it was, it was just like constantly trying to be like putting out a fire here. This person's upset.
Yeah.
With this one health system or one hospital that was literally the worst. They're terrible people. And were they in Michigan? No, not this one.
All right.
I won't say which one. It was terrible.
But they weren't in Michigan.
No, it was terrible.
Nobody would be like that in Michigan.
No.
I
mean, there are people that are tough. I get tough.
Yeah.
That I understand. But these people are just bad.
Yeah.
And it just took up like all my time. I'm like, I'm spending all my time on a hospital. It doesn't really matter at the end. You know, it's like we could actually just do nothing with them. It probably overall doesn't actually hurt our numbers. You know, it's like, but that was hard.
Yeah.
But the thing these growing up, it's like these are the things you got to do sometimes.
Well, rev cycle,
fail at stuff and
rev cycle is really hard.
So that's why I say, like, later in life when I was at HealthRise, I was like, they call me professor because I would be teaching. I'm a decent teacher, so I was like,
yeah.
I think I just knew so much because I was like, I don't know, it was like trial by fire. You know, it's like I learned a lot because
you had to.
I had to, and I failed a lot.
Yeah.
So I don't know. I guess you learn a lot when you fail a lot.
But you like teaching. You're a good teacher. Like what you're doing, your presentations on health insurance. Like,
yeah,
you're in your glory.
That's the one I'm excited about. I was doing pretty good. I was nervous going into that too.
Yeah. Well, it's
because you didn't
know about it. I mean, it's something that's new.
Going into that talk actually.
Yeah.
I'm not usually nervous and like go into it, and I was like, I'm really nervous. Like, what if these guys like just tell me I'm an idiot? And of course they know all this stuff or whatever. I was like, I don't know. Maybe they just all know this. Like, I don't know it, so I guess I'll just share it with everybody else.
No, and you've done more research since then. Because I think I heard you talk on maybe it was recorded or something. Or...
I did next week. I did another version of it.
Yeah. But
I changed kind of the ends and made it cleaner, a little crisper, and like what I really wanted to cross at the end. Yeah. And so I thought it was, I thought it was really good as far as like people's feedback was like really pushing the envelope of what's possible, but also like they didn't know any of that stuff, which is how I felt. So I mean, it wasn't like people were like, "Oh, I knew all that." I was like, "No."
I mean, I knew
snippets.
A lot of it because of managed care. You're working with payers all the time, so I was in the payer world. But hospital operators, revenue cycle people, that they don't really deal with insurance, but they don't kind of understand all that.
I went to graduate school, and I don't remember being taught any of that stuff. I mean, honestly, what we get is like, well, Medicare started here, and like. I didn't even cover that stuff. I was like, we all kind of know that. But the previous stuff is what I thought was fascinating.
Yeah.
All right, we're at time. I got to take this back over. Right?
I'll give you the mic back.
That's amazing. That was great. Well, thanks, Philip, so much.
Right, enjoyed it.
Appreciate you, man.
Thank you. Appreciate you.
Okay.
Take care.